Ask the Expert segment is sponsored by Maine Health.
Good morning, everyone. I'm Katie Sampson coming to you live from our digital studio. We just got off our desk at Good Day Maine, finished up our newscast, and we're actually continuing a conversation that you may have seen around 8:42 or so, talking about opportunities job-wise in the healthcare industry. So I'm going to bring in now Helene Kennedy, who is the Maine Health VP of Talent Acquisition. Good morning, Helene. Thank you so much for being here with us this morning.
Thank you for having me.
We had a great conversation on Good Day Maine just a few minutes ago, and we kind of thought, hey, let's continue that over on Facebook and our social media pages, so we can kind of get more into that conversation and also maybe answer some questions for some of our viewers as well. Basically, I think that what is a really good message that you're trying to get out there is there are so many different opportunities that people may not even realize, and they could easily maybe shift into this healthcare field, even if they don't necessarily have a lot of experience in it.
Yeah, absolutely. And that goes for, direct patient care. Even if you don't have experience in that area, we have multiple training programs. So we have a medical assistant training program, a surgical tech where you get to be in the OR. We have a phlebotomy, which is the folks that draw your blood. We have training programs around those. But we also have some positions that don't require any training. When you go to a physician's office, folks that check you in at the physician office are fabulous in customer service, and we will do all the training that you need to have that position. And then when you think about maybe not patient facing, maybe you're thinking that's not really what I want to do. We also have a huge business that supports our front care workers. So we have human resources, we have marketing, we have finance, technology positions, you name it, we've got it. And entry level all the way up to the most experienced people out there. So just an abundance of opportunities.
And we were also talking about just how rewarding it can be to be in this industry. Tell me more about that.
Oh yeah. I mean, I was telling you a little bit about my personal story when my dad, who was 91 and lived a great life, was at the end stage of his life, and just the emotion I felt around knowing that the people that were taking care of him were people that my team helped to recruit. So that's a good example of the impact that it has when you go home at night, whether you're taking care of patients or you are someone who is supporting the team that is taking care of patients. You go home and you realize the impact you made on your community, and that you're contributing to taking care of the people that you love the most and that matter the most to you. And I just can't think of anything more powerful than that.
Absolutely. And can you talk maybe a little bit anecdotally just about some of the stories you've heard about people making this, kind of jump into the healthcare field, or some of the people you're hearing from who are saying, hey, I never really thought about this, but maybe I am interested in pursuing this?
Yeah, definitely. I mean, we have people who, have entered our organization, even people from other countries who've entered our organization in entry level positions and have just loved the work that they're doing, and then have partnered with Maine Health to advance their careers and maybe move into direct patient care. And we hear from them all the time how rewarding that has been, not just the work you do, Katie, where you're taking care of patients, but also how rewarding it is to be at an organization and in a field where you can really grow your career, where you can really see that you could be there for 20 years and have, multiple different careers, because there's so many opportunities and so much need, especially here in our state, for sure.
Yeah, and what's sort of the conversation, or how do you get started if someone's maybe watching right now and they're thinking, yeah, I kind of at least want to get more information. Would they be talking with a recruiter, and what kind of questions maybe would they be asked and they could be asking?
Yeah. So, I mean, you can certainly go for Maine Health. You could certainly go to mainehealth.org/join the team. And there's a lot of, and I talked about this a little bit in the last segment, there's a lot of information there about various careers. And we even have videos where folks talk about their careers and how they got started. And I think those can be really powerful. But you also, if you're, thinking, this position sounds interesting and you want to submit an application, at that point, it would trigger contact with a recruiter. And then the recruiter can have more extensive conversations with you about that. Also, keep an eye open. A lot of events out there, and we're out there at job fairs and career fairs. We're in the high schools. And while we're there, we can help educate you on what the available opportunities are.
Do you think, I mean, this is just something that kind of popped into my head just while we were chatting earlier. Obviously we saw a lot of shifting career-wise during the pandemic and people kind of reevaluating, what they want their life to look like and so many factors. Do you think that you're still seeing some of that? And maybe what was that like during the pandemic as well?
It was hard. The pandemic was so difficult, especially in healthcare and in particular on our frontline workers. And I think a lot of people, healthcare, not healthcare, reevaluated, because it was just such a traumatic experience for everybody. And we're seeing less of that now. We personally have seen our application flow going up over the last several months. So we're seeing more interest in our healthcare careers. We are tracking 25% ahead of last year's hiring for new grad nurses. So I'm seeing some light sort of coming in. I'm seeing people starting to gain more interest in working in healthcare, and that's really exciting for us. So I do think as the country is moving out of the pandemic and more into what norm is, I guess, we're starting to see that transition as well.
Yeah, and I also wonder if, some people are rethinking, hey, this is a rewarding field and look at all the hard work they put in, and maybe that's something I want to be a part of. Maybe it inspired some people to choose the healthcare industry.
I know that it did. Yeah, absolutely. And I think there's no doubt, I have so much admiration for our frontline workers. There's no doubt that they made an enormous impact in our community, and I'm super proud to be part of that team.
What type of people are you hoping are maybe watching or hearing this that may want to consider these opportunities? Or do you think there are any misconceptions? We kind of talked about that, as some people don't realize all the opportunities that are available to them.
Yeah, I mean, I would love to reach people who are really at a point where they're trying to decide what they want to do for their career, or they're thinking about a change in a career. And think about healthcare and how broad it is, and think about defining that differently. That you may think of yourself as, oh no, I don't think I could provide direct patient care, but there's so many other ways you can impact patients' lives. And so I'm hoping that's the message. We have a lot of positions that are highly technology positions, but you're still working with patients. So all of our testing functions, things like that. And then, as I mentioned before, we have a lot of positions that are more business-like positions that are supporting the frontline workers. So I hope if we don't get anything else across, that this is such a powerfully impactful career. And it also is a career path with a lot of variety and a lot of opportunity.
And part of that conversation, maybe with recruiters or as you're, doing the application process, I imagine there are questions about, where do you ultimately want to end up? It's okay if you don't know, but it seems like you're very, very encouraging as far as we'll help you get there and we'll help you grow within, the Maine Health system.
Yeah, we have a lot of Earn While You Learn programs in place right now where we're actually hiring people into what we call student roles, educating them, and then moving them into positions. And then within those positions, there are career ladders. So when you gain additional skills, you can advance just within that position. But then also we have tuition assistance and we have relationships with universities to help us advance folks' education if that's what they're looking for. So just a lot of ways that we're trying to support our care team members, and we're innovating every day. I mean, that's the other thing I probably didn't touch on. I should have, is this is quite an innovative industry, and that keeps it exciting. And so we're innovating and new things are coming up every single day. It's never a dull moment.
Yeah, exactly. And that's, why we're here today, just hoping to help spread the word, to inform people about those opportunities. Where do you think would be the first step for people to maybe pursue this?
Yeah, I would say definitely go to mainehealth.org/join the team and take a look at our website and some of the information there. And some of the positions you apply directly for, but some you can just submit an interest form, and then a recruiter calls you and just talks to you about it. So there's some that you'll see that you don't even have to apply. You can just say, I'm interested in this and I want to learn more. And then somebody will contact you and educate you about that.
And any final thoughts? What's sort of the just basic, final thing that you would like our viewers to know when it comes to pursuing opportunities in healthcare?
Give us a try. Just call or express your interest rather through the website, and give us an opportunity to educate you about healthcare careers. It may not end up being what you look for, but I think you could find it to be incredibly exciting and very rewarding.
Doesn't hurt to give you a try, just like you said.
Absolutely.
Colleen, thank you so much for your time this morning, and just helping us spread the word and give our viewers another option if they're looking for another job.
Thank you, Katie. Thanks so much for having me.
Absolutely.